This is another podcast from Alpha Business Media. Welcome to the Deep Dive. Today, we're taking you on, well, an incredible journey to the roof of the world, Nepal. Now, when you picture Nepal, you probably think of those majestic Himalayan peaks, right?
Absolutely. Stunning.
But for millions of people living there, those same mountains are a huge barrier, a barrier to something really fundamental, healthcare. We're going to unpack how, a severe health crisis, made even worse by that extreme geography, is being tackled by a quiet tech revolution.
Yeah, and what's really compelling here is how Nepal's challenges aren't just separate problems. Experts call it a syndemic.
A syndemic.
Exactly. It's not just one health crisis, but multiple health issues and social factors all tangled up, reinforcing each other. It's a dangerous cycle. We've got some really illuminating sources here that peel back the layers on this complex reality, and they introduce us to some amazing local startups. Entrepreneurs turning everyday things like smartphones and cloud technology into actual lifelines. So our mission for this deep dive is to understand how they're creating health without borders in one of the world's toughest environments, really turning constraints into, well, opportunities.
Okay, let's unpack this crisis then. Imagine you're in a remote village, right? Someone in your family gets really sick. The nearest basic health post might be a day's walk, a proper hospital, maybe several days on foot.
Right.
And an emergency. That often means an incredibly expensive helicopter ride. Risky, too.
Yeah.
And that's only if you can somehow afford it or arrange it in time. It's not just a hypothetical thing. It's the harsh reality for so many families.
It really is. And if we zoom out a bit, Nepal faces a truly catastrophic shortage of medical staff. Get this, there's only one doctor for every 25,000 patients.
25,000.
Yeah. Compare that to the WHO's recommendation, one doctor per 1,000 people. It's just drastically short.
Wow.
And what makes it even harder is that most qualified specialists, understandably maybe, they cluster in Kathmandu. That leaves huge rural areas with basically no medical care at all, a massive underserved population.
That disparity is staggering. And it's not just a numbers game, is it? Beyond the sheer lack of doctors, what other big health challenges do the sources point to? What makes this crisis even more complicated?
Yeah, a really crucial point from the sources is what they call Nepal's triple burden of disease.
Triple burden.
So on one hand, the country's still fighting high rates of infectious diseases, things like tuberculosis, diarrhea, things we sometimes associate with, developing nations. And they also face some of the highest maternal and child mortality rates in the whole region. It's about 142 maternal deaths per 100,000 live births. Really distressing numbers.
Terrible.
But then, and here's where it gets really complex, at the same time, there's this huge surge, like an avalanche, of non-communicable diseases, NCDs.
Like heart disease, diabetes.
Exactly. Chronic conditions. And these now account for something like 66% of all deaths in Nepal. Cardiovascular diseases are the #1 killer. But here's something that really stands out. Nepal also has the world's highest death rate for chronic lung diseases like COPD.
Chronic obstructive pulmonary disease.
Right, conditions that block airflow. It's 182.5 cases per 100,000 people. And this is largely because so many people cook using biomass wood, dung, often indoors, in poorly ventilated homes.
Yeah, the indoor air pollution.
Precisely. And it tragically hits women and children the hardest because they spend the most time near the cooking fires.
So you've got this awful health mix, infectious diseases, terrible maternal and child death rates, and this explosion of chronic diseases like heart and lung problems. All of that combined with this incredibly mountainous terrain, 75% mountains, you said.
Yeah, 3/4 of the country.
Which makes just getting anywhere incredibly hard. And then the healthcare facilities that do exist, mostly in cities, are overcrowded, often not well equipped, and they struggle with constant power outages. It sounds like a perfect storm.
It really is, and it raises a tough question. What happens when that kind of systemic dysfunction doesn't just cost lives, but also drives away the very people you need to fix it?
The brain drain.
Exactly. The sources highlight a significant brain drain. Doctors, nurses, but also engineers, IT specialists. After getting their education and skills, many leave Nepal for better opportunities elsewhere.
Which just makes the original problem worse.
Right. It's a vicious cycle.
Yeah.
The people who could be building solutions are leaving, widening the gap for everyone left behind.
It's easy to feel a bit hopeless hearing about all those obstacles, but, amidst these massive challenges, our sources show something else is happening, quiet but really powerful revolution.
Hmm.
The COVID-19 pandemic, like in many places, actually became this unexpected catalyst. It accelerated Nepal's move towards digital health. Telemedicine went from being like a niche idea to something absolutely vital.
Absolutely. And this shift got real support, both from within Nepal and internationally.
Mm.
The government launched its Digital Nepal framework.
Well, I read about that.
Yeah, and they specifically named healthcare as one of 8 priority sectors. They set ambitious goals: a national digital healthcare program, a central teleconsultation hub, a better electronic medical record system, EMR 2.0. And international partners like the WHO, EU Humanitarian Aid, they chipped in too. They funded the first national teleconsultation center at Bir Hospital in Kathmandu.
Did it work?
It really did. It proved the model could work, providing advice and consults to thousands of people. It showed that digital care wasn't just possible, it was essential.
So that's a strong foundation built by government and international help. And on top of that, we're seeing these really creative local startups popping up. Let's talk about GV, founded by Apushan Jyoti Kansakar. It sounds like it's aiming to be the main digital front door for healthcare for ordinary Nepalese. How's it helping patients?
GV is a classic BDC business-to-consumer model. It's directly trying to solve the patient's biggest problems: access and convenience. It's got several parts. For instance, it has an e-commerce side for genuine health and baby products. That's actually really important because, sadly, counterfeit medicines can be a problem there.
Okay, so reliable products.
Right. Then, the core is its Namaste Doctor feature. That offers online consultations. Users can choose free or paid options, do video calls, get priority slots, and even upload lab reports for the doctor to see.
So bringing the doctor to the patient virtually.
Exactly, no matter where they are.
And this next bit sounds really innovative. Digital prescriptions. How does that work?
Yeah, this is quite clever. You can literally take a photo of your paper prescription, upload it to the GV app,
Huh?
and then a pharmacist at GV digitizes it, puts it into the system. Then you can order your medicine for home delivery right from the app.
Wow. That's not just convenient. It means you start building a digital medical history, right? Which must be amazing for tracking health over time.
It's a huge step forward, both for convenience, obviously, but also for that crucial tracking of health information. The founder's mission is pretty clear: cut down those long queues and waiting times you see at clinics and hospitals, make healthcare more efficient, more accessible.
And are people using it? What's the feedback?
User reviews seem really positive. They suggest GV is achieving that goal, often with very competitive prices too, which helps make quality care more affordable for more people.
Okay, so if GV is the digital front door for patients, then Cogent Health, which is B2B business to business, sounds like it's building the digital backbone for the hospitals and clinics themselves. How are they different? What problem are they solving?
That's a great way to put it. Cogent Health, they're actually part of F1 Soft International, Nepal's biggest fintech group. They aren't really patient-facing like GV. Their CEO, Daniel D. Shrestha, and his team, their mission is focused squarely on the providers, tackling the chaos within hospitals and clinics. The piles of paper records, data stuck in silos, the lack of efficient systems.
Right, the behind-the-scenes stuff that still affects patients.
Exactly. Their main product is Cogent EMR. It's a web-based hospital management system, integrated. Covers everything from patient registration, billing, pharmacy, labs, clinical notes. It even links up with the National Health Insurance System. It's basically designed to bring a whole hospital's operations online.
So how does that help the patient in the end? What's the tangible benefit for someone needing care?
Well, Daniel Shrestha's big vision is creating an interoperable digital healthcare ecosystem.
Interoperable, meaning the systems can talk to each other.
Exactly. Patient data could move smoothly between different departments in one hospital, or even down the line between completely different clinics or hospitals. The dream is to end that situation where patients have to carry around stacks of paper records everywhere they go.
That would be amazing.
And it's already showing results. One study they mentioned at a cancer center saw the rate of proper medical history documentation jump from about 26%.
Wow, that low.
Yeah, up to over 82% after they put in the Cogent EHR system.
Huge improvement.
Massive. And here's where their fintech connection is really smart. Daniel pointed out that billions are spent on healthcare in Nepal each year, but almost none of it goes through digital payment systems.
So cash is still king, creating bottlenecks.
Totally. So by building billing and digital payments right into their EMR, Cogent Health is solving a huge headache for both the clinics and the patients. Makes the money side of things way smoother and more transparent.
It really sounds like the magic happens when companies like GB, the patient front door, and Cogent Health, the hospital backbone, can fully connect. Imagine a doctor on a GV video call pulling up a patient's full history from a Cogent system instantly.
That's the goal, a truly seamless, holistic digital health experience.
Okay, but even with great telemedicine, sometimes you just need a lab test, right, for a proper diagnosis.
Absolutely.
But in Nepal's mountains, getting a sample from a remote village to a lab, that can take days. And the sample might degrade, giving you bad results.
Like the transport issue is huge.
And then there's that cold chain problem you mentioned earlier, keeping vaccines, lab reagents consistently cold, almost impossible with unreliable power in remote areas.
Exactly. So this raises that critical question.
Yeah.
How do you get advanced diagnostics to the absolute last mile, to those really remote places? And this is where Biovac Nepal comes in. It was founded by Dr. Debesh Karmacharya. He's a PhD scientist who actually came back to Nepal after a successful career in the U.S.
Okay.
And his philosophy is key. It's not about just importing fancy, expensive Western tech that might break down or be hard to maintain.
Right.
Instead, they focus on creating solutions specifically for Nepal's tough conditions. It's a concept called constraint-based design.
Constraint-based design, so using the limitations to drive innovation.
Precisely. The idea is that real breakthroughs often happen when you design within the toughest constraints.
Yeah.
You end up with tech that's naturally more robust, affordable, and scalable, not just for Nepal, but maybe for other challenging places globally, too.
Now, this next part really grabbed me. They've created a lab in a backpack. That sounds like science fiction.
It's pretty amazing, but
Yeah.
also very practical. Biovac uses and adapts these portable diagnostic devices. Things like the Biomeme thermocycler for PCR.
PCR, that's the DNA testing method.
Yeah, polymerase chain reaction. It lets you detect tiny amounts of pathogen DNA or RNA quickly. And they also use things like the nanopore minion for DNRNA sequencing, basically reading the genetic code of viruses or bacteria in real time. And the key is they use these on-site, in the village clinic, maybe a temporary field station, even right at a suspected contaminated water source.
So no need to transport the sample.
Exactly. It eliminates that whole transport problem, prevents sample degradation, and gives you results much faster, which is critical if you're dealing with an outbreak.
Yeah.
Plus, the data they collect can be geotagged, linked to a specific location, and sent back via 3G networks. This creates this incredibly powerful real-time map of where diseases are popping up, epidemiological surveillance.
Wow. And they actually used this during COVID.
They did. Successfully used it to track virus spread by analyzing wastewater in Kathmandu. Gave public health officials vital early warnings.
That's seriously impressive. And they also tackled the cold chain problem with a heat-stable vaccine?
Yes. Another major innovation, they developed a vaccine called Ranigal Dunga against Newcastle disease.
Which affects?
Poultry. Chickens. It's devastating for farmers. But this vaccine is thermostable.
Meaning it doesn't need refrigeration.
Right. It stays effective at room temperature for up to 30 days. And crucially, it comes in a simple tablet form. You just dissolve it in water for the chickens, or even drop it into a bird's eye.
So simple. No needles, no electricity needed.
Exactly. It makes vaccination truly possible for farmers in the most remote villages, protecting their livelihoods and a key food source.
So Biovac, starting with veterinary medicine, protecting poultry, that seems like a strategic first step. What does that really mean for people, for public health in Nepal?
Well, what's fascinating here is the One Health approach they're taking.
One Health, meaning human, animal, and environmental health are all linked.
Precisely. By protecting poultry, which are a vital source of protein and income in rural downs, Nepal Biovac is directly fighting malnutrition and making communities more economically stable. That's a public health intervention right there. And maybe even more importantly, when you build systems to track animal diseases, you're essentially creating an early warning system for potential human pandemics. So many infectious diseases jump from animals to humans.
Like bird flu, for instance.
Exactly. So it's a really deep, long-term strategy addressing the root causes of public health issues. It shows how innovation, when it's really grounded in local needs, can connect knowledge with practical action and have these ripple effects across a whole community.
These innovations are genuinely inspiring, but like you said, they're being built on a foundation that still has, well, some significant cracks. What's actually driving this growth? What are the positive forces despite all the challenges we've talked about?
Yeah, there are some definite, powerful tailwinds, as they say, pushing things forward. First, Nepal has amazingly high mobile phone penetration. Active connections are actually more than the population, like 120 to 140%. So almost everyone has access to a basic mobile device.
Yeah.
That creates a fundamental platform for digital services.
Okay, so the phones are there.
Right. Then there's government support. We mentioned the Digital Nepal Framework, and they've also declared 2024 to 2034 as the IT decade. That signals a strategic commitment, at least on paper. International aid is also key. Organizations like the WHO, USAID, the World Bank, they provide crucial funding, technical help, expertise. They help build capacity. And finally, there's Nepal's growing talent pool. Thousands of IT graduates every year. It's actually becoming quite an attractive place for Western companies to outsource complex work, not just call centers, but serious analytical platforms, AI systems. There's a skilled workforce emerging.
But you mentioned cracks in the foundation. So what are the major headwinds? What are the biggest obstacles these innovators are still pushing against?
The main one, the really big shadow over everything, is what the sources call the Great Digital Divide. And it's not just one single problem. It's really three interconnected challenges bundled together.
Okay, what are they?
First is access. We said mobile phone penetration is high, but actual internet penetration, only around 50% nationwide.
And in rural areas.
It plummets, down to just 17.4% according to the sources, compared to almost 80% in the Kathmandu Valley. So vast numbers of people are still effectively offline.
Okay, access is number one.
Second is availability. Even if there's internet coverage, can people afford the devices and the data? The cost of a smartphone could be up to a third of someone's monthly income.
Wow, that makes it a luxury item for many.
Absolutely. Not a widely accessible tool. And third, and this might be the deepest, toughest part, is the skills challenge, digital literacy. The World Bank found that a staggering 91% of Nepali adults can't perform basic digital tasks. Things like copying and pasting text on a computer or phone.
91%.
Yeah. And there's a big gender gap, too. Women often have even less digital exposure or training. So what this means is, even if you could magically give everyone a free smartphone and free internet.
They might not know how to use a medical app or navigate these digital health services.
Exactly. The tech could be brilliant, but useless if people can't engage with it.
That's a really stark reality. So even with amazing tech and incredible local ideas, if people can't use it, can't afford it, or can't get online, the impact is just fundamentally limited.
Precisely. And there are other headwinds, too. Chronic power outages are a constant problem, crippling digital tools. There's a serious lack of modern IT infrastructure outside the main city, Kathmandu. Government support, while declared, sometimes stays on paper. The implementation doesn't always follow through consistently, and that brain drain we talked about, it continues to limit the growth of these local tech companies themselves. They need skilled people to expand.
It's a tough environment.
It really is. But what's truly fascinating, despite all this, is how Nepal's health tech scene is kind of becoming this unexpected test lab for a new model of global IT work. Companies are setting up engineering hubs in Kathmandu. But like I said, not for basic call centers. They're building world-class analytical platforms, sophisticated AI systems, often designed from the start to meet international standards.
That's so high-level tech development.
Exactly. And BioVac's plan to eventually export its solutions, like those heat-stable vaccines developed under constraint. That's a prime example. It really raises this important question. Can Nepal actually shift from being mainly a recipient of aid to becoming an exporter of advanced tech solutions and innovative public health approaches?
It's a really interesting thought. So looking back at this whole deep dive into Nepal's health tech journey, what really stands out to you? For me, it's just this powerful story of incredible resilience, amazing ingenuity, and this deep, deep commitment from local entrepreneurs. They didn't sit back and wait for someone else to solve their problems. They built their own solutions right there. And they're proving that innovation that comes directly from facing real needs and tough constraints can be incredibly effective, really impactful.
I couldn't agree more. See companies like GV just relentlessly building those digital bridges between patients and doctors, getting people reliable advice and products. Then you have Cogent Health, methodically laying down that digital foundation for hospitals, making the whole system more transparent, more efficient, and ultimately, you hope, more focused on the patient. And BioVac Nepal, they're just rewriting the rule book for diagnostics and prevention, using technology designed specifically for the toughest conditions on Earth. Together, they really are shaping a future where getting quality healthcare isn't just about where you happen to live or how much money you have, but, and it's a big but, technology by itself isn't some kind of magic wand.
Right. So looking ahead, what does this all mean for the path forward? How do we make sure these amazing innovations actually reach everyone, especially those who are currently left out?
Yeah, that's the critical question, isn't it? How do we ensure equity? Our sources really point towards a crucial two-pronged approach. On one hand, you need that continued bottom-up support for the grassroots innovation, creating a better investment climate, maybe streamlining regulations for these local entrepreneurs, keep fostering that local talent.
Okay, support the innovators.
But just as importantly, maybe even more so, you need decisive, consistent, and really well-funded top-down action from the government, from international partners. And the absolute #1 priority has to be bridging that triple digital divide we talked about.
Access, availability, and skills.
Exactly. That means investing not just in the physical infrastructure, like getting fiber optic cables and better mobile networks out to remote rural areas, but also figuring out how to make smartphones and internet data genuinely affordable for the poorest people. Subsidies, maybe community access points, things like that.
Making it economically feasible.
Right. And perhaps the most vital piece, large-scale, nationwide campaigns to dramatically boost digital literacy. Really focus on teaching basic digital skills, especially for women and older populations who often get left behind in the digital shift. Because without tackling those fundamental issues, access, cost, and skills, all these cutting-edge digital health solutions, no matter how brilliant, are just going to remain frustratingly out of reach for the majority of people who need them the most.
It's clear the journey to health without borders in Nepal is definitely long, it's definitely challenging. But what this deep dive has really shown us is that Nepal's own innovators are proving it's not just a pipe dream, it's an achievable reality they're actively building. And that prospect you raise of Nepal potentially shifting from aid recipient to an exporter of advanced tech and public health models, all driven by these incredible local entrepreneurs, well, that's truly a provocative thought for all of you to mull over.